I'm pleased to be joined today on Health Beat by Kayla Daniels, a physician assistant with Faith Regional Physician Services Pediatrics in Norfolk. And today we're talking about RSV. So Kayla, share with our viewers some more information on RSV.
Well, sure. Thanks, Rob, for having me speak today. RSV is one of the more common viral illnesses that children get. In fact, most children contract it by age 2 and can unfortunately have it multiple times during a single season. RSV is very contagious. It's one of the things that if your child goes to daycare is exposed to quite frequently. It can be on surfaces for up to 6 hours. It can be on unwashed hands for 30 minutes. It's spread via respiratory droplets, so coughing and sneezing, sharing utensils, all things that kids are very well known for doing. Some of the common symptoms of RSV are cough, runny nose, sore throat, fever. The little ones get really fussy and their appetite goes down quite a bit. Symptoms typically last for up to a week. That RSV cough can last for a couple weeks though. The peak days are usually days 3 through 5 when kids are at their worst. Unfortunately, RSV hits some kids a little bit harder, especially those that were born premature, those with compromised immune systems or underlying heart and lung conditions. Only 3% of kids actually get hospitalized, so thankfully most kids do just fine. But there are some things we need to watch out for, even in your otherwise normal, healthy child. A couple things are their breathing. So if you notice your child is breathing fast, really sucking in those tummy muscles to breathe, kind of flaring at the nose, then that's an emergency room visit and should be evaluated right away. Other things we typically see with RSV, ear infections. They kind of go hand in hand with RSV just because it gets so much nasal drainage that backs up behind the nose. So if you have a child that's really fussy and has a fever longer than 3 days, probably should get in and get checked out.
What's the typical fever?
Typical, children 100.3 and less under the age of 3 months, we should get evaluated. If it's 100.3 or higher and they're older than 3 months, then we usually let that run to 2 to 3 days. But if it's higher than 104, then we should see them right away.
Well, we really appreciate that information today. I'm sure our viewers are going to appreciate it as well.
Thank you very much.
Thanks for being here. And that's Health Beat, brought to you today by Faith Regional Physician Services.